Welcome to this four-part video series on understanding metabolic syndrome and treatment options in patients with type 2 diabetes, presented by Superior Health Quality Alliance. This recording was developed for healthcare workers with an interest in providing care to individuals with diabetes 2 and metabolic syndrome. In this third video, we'll be covering treating metabolic syndrome and treating diabetes 2. You may watch each video in order or based upon your interest. The objective for this video is to evaluate the risk and benefits of pharmaceutical and non-pharmaceutical treatment options for both metabolic syndrome and for diabetes. Our goal is that after the video, you will have a better understanding of this topic and how it applies to your own healthcare setting. Caring for patients with both metabolic syndrome and diabetes should be done with a patient-centered approach. So if you're telling patients, you need to do this, you need to do that, it typically isn't going to work because most of these recommendations require behavioral changes. And the best way to impact behavior is to use motivational interviewing as the foundation. The goal here is that you're collaborating with your patient. It's a partnership, not a dictatorship. With motivational interviewing, you're using coaching or counseling-like styles that empower patients to participate in their care and in developing a treatment plan that meets their individual needs. Utilizing resources can be powerful when they speak to a patient's specific question or concern. They should supplement your discussion with the patient and not be used in replacement of it. Also, an interdisciplinary team approach really is the best way for a patient to receive education and treatment from an expert in each area of care. The team may include an endocrinologist, dietitian, nutritionist, or diabetes nurse educator. The dietitian or nutritionist has the expertise to help the patient understand how foods affect the body and help them find the right foods based on their own tastes and food preferences. Lastly, the importance of the words we say can make a difference. Rather than saying words like diet and exercise, use a more positive approach by using words like eating healthier or movement. Yoga is movement, but it doesn't require a rigorous workout. Working with patients to make small steps of change is much better than them trying to make all of these changes at once. Patients can easily become overwhelmed and disengage in their treatment plan. Management should be targeted at treating the conditions contributing to metabolic syndrome and diabetes type 2 conditions to reverse or slow down its progression. So here's where we're engaging, inspiring, and empowering patients because this is the best way that they can make lifestyle changes. We know that these changes disrupt their normal daily routine, the way they socialize, and the things they enjoy doing. And to quit smoking is by far the most difficult of all because it's a very powerful addiction. And it's not easy to change your eating habits. Eating far less foods with processed sugar and eating more fruits and vegetables, especially those vegetables, can be difficult. And for women especially, we sure love our comfort foods. We like to eat when we're stressed, when we're happy, when we're sad. We just love our food. And environmental changes can improve metabolic syndrome by influencing lifestyle factors like diet and physical activity. Having increased access to green spaces, walkable neighborhoods, and readily available healthy food options ultimately lead to reduced body weight, improved blood pressure, and better blood sugar control. These are the Joint National Council guidelines for the treatment and management of hypertension, which includes a targeted blood pressure in the general population of below 140/90. And for those with diabetes, a targeted blood pressure below 130/80. However, as with any guidelines, clinical judgment should always be used. In the most recent JNC guidelines, they state that age should be factored in. So anyone age 60 or over should have a blood pressure goal less than 150/90. And triglycerides, the bad cholesterol, should be lower than 150. Patients with severe obesity may benefit from bariatric surgery. Typically, it's based on a patient's BMI, and this treatment is considered evidence-based. There's a lot of risk, but there's also a lot of benefit. So again, collaboration with the patient is key. These are your glucagon-like peptides 1, and they're the pill options approved for treating diabetes and weight loss. These medications lower your blood glucose and contribute to weight loss. Your SGLT2s do as well. The GLP-1 agonists are indicated for managing blood sugar levels in people with type 2 diabetes, and they can also help treat obesity. These drugs are most often injectable medications given in the fatty tissue just under the skin. They're getting a lot of attention because of their proven ability in weight loss, making them a great choice for patients that have both diabetes and metabolic syndrome. As with all medications, you need to balance the risks and benefits collaboratively. Here are the SGLT2 drugs, and they work a bit differently. These are SGLT2 considered inhibitors, and they're a class of medications that help lower blood sugar in adults with type 2 diabetes. And they do this work by preventing the kidneys from reabsorbing glucose from the blood, causing the excess sugar to be excreted in urine. GLP-1 medications mimic the action of the hormone glucagon-like peptide 1, which is why they're called GLP-1. The blood sugar levels start to rise after we eat, so either this sugar is going to be pushed into our cells and converted to energy, or it's going to sit outside the cell, leading to high blood sugar levels that have negative consequences, eventually ending up stored as fat, which we know leads to obesity. The medications, these medications increase the body's insulin production, which then pushes the sugar into our cells. Bariatric surgery is considered the most effective therapy for metabolic syndrome. The most common procedures are the laparoscopic adjustable gastric banding, laparoscopic Roux-en-Y gastric bypass, and the laparoscopic sleeve gastrectomy. Patients who have these surgeries should have long-term follow-up to avoid surgical, nutritional, and psychiatric complications. In summary, the key goal in treating metabolic syndrome is to reverse or slow its progression, which then reduces the risk for heart disease, stroke, and diabetes. Treating and managing both metabolic syndrome and diabetes requires a multimodal approach. It should include patient education, behavioral changes, medications, and in some cases, bariatric surgery. Our next video in this series, Partnering to Improve Diabetes Management, Video 4, will go through a case study to diagnose and identify treatment options in patients who may have metabolic syndrome or diabetes. Here are some tools and resources to further explore the content covered in this video. If you have any questions about this video series or others, please contact us at info@superiorhealthqa.org. Thank you.